President Trump signing an executive order at the White House directing Commerce Secretary Wilbur Ross, that you see next to him, to investigate the aluminum industry. Many companies represented, of course, and associations from the industry in the White House, in that room, as you saw. And what is the result of this investigation going to be once the report comes back from the Commerce Department and Secretary Ross? Maybe tariffs, maybe taxes. We talked about this at the beginning of the show. More than 50% of the aluminum industry is now controlled by China. A lot of this, of course, bringing jobs back to the U.S., as you heard many of those CEOs saying. By the way, the CEO of Alcoa was in the room. We were looking at the stock during those comments. The stock is down just a little bit, almost 4%, as well as Century Aluminum, Kaiser, but certainly Alcoa, one of the biggest names in the aluminum space. So we wanted to bring those comments to you. We shall see if jobs come back to the U.S. I want to bring back in right now Ford O'Connell and Don Calloway. And guys, we talked about aluminum at the top of the show, but we need to pivot back to health care here, because the timing of this, if there was a vote for it in the House on Saturday, that would be the 100th day for President Trump. The symbolism can't be dismissed on this one. Do you think that Congress, the House, is going to push it through to then?
I don't think they're going to get it this week, believe it or not. We'll get it when we have 216 House votes. Understand what's going on here in the big headline with respect to Obamacare. That is, the GOP is trying to show some inter-party bipartisanship. The Democrats are completely exempt from this argument. They don't want to do anything about Obamacare. In fact, they want government-funded universal health care. So what you're watching is Republicans bargaining with themselves, and when they actually get the 216 votes, they'll pass it through the House. It'll move on to the Senate, and it'll probably look completely different once it's done through the Senate than it looks right now. So this is about a process, and Republicans making sure they don't look like fools by putting it up there and not having the votes.
You know, for one of the things, Don, that I was looking at was the ratio under the proposal. So you've got states that can opt out of certain rules. That's part of this new plan that we've seen with, of course, federal government approval. That, I would think, would pacify some Democrats on this, even though they're going to say no. But the ratio, right now you have a 3-to-1 ratio where you can only charge 3 times the amount you charge a younger person, an older person, for their health care coverage. They want to widen that to a 5-to-1 ratio. Don, that is an economics question, but it seems to me that's a good business decision. Do you agree with that part of the proposal that we're seeing now?
You know, I just don't know enough about that much of it, Cheryl, to comment. And that's part of the problem, is that we have this bill that's being rushed to the floor on Friday or maybe a Saturday vote to try to fit into this symbolic and arbitrary 100-day rubric. But if you remember Obamacare's passage and its process in 2009, by this time, before the bill passed, we had talked about pre-existing conditions and being insured until age 26. And we talked about death panels. And the American public had really vetted the mandate and the different parts of this legislation. We don't know what's in this bill. And I appreciate you're dropping.
Well, we don't know.
We don't know much about what's in this proposal. And the reality is that the American people have not had a chance to kick it around in the court of public opinion, and that's troubling to me.
Okay, in political parlance, what Don just did is stalling and slamming the bill. To your economic point, Cheryl, you asked about being able to charge up to 5-to-1 is a political loser, but the economic theory says that under the Republican plan, the health prices will go down, so 5-to-1 does not look as stark 2 years from now as it does at the moment. This is something that the Republicans have to message, is the idea that they can drive down health care costs. If
Ford,
they can, it will be a winner.
What are the tenets of this bill? We want to, your party wants to replace Obamacare and revoke Obamacare, but with what? And the American public writ large, I would even argue most members of Congress writ large don't know what's in this bill.
Guys, look, there's several things in here, but in particular, I think, and we don't have enough time to go through all of it, Don, but really, it's about giving every state, and Paul Ryan said this earlier today, every state is so complex, the system is really a state's issue versus a federal issue. Instead of having health care for all across the country, this really does give more power to the states, Don, and I think, and businesses as well. And I think that there's a lot that we should analyze and look at, and we don't have time to do it right now, but we're going to do it.
Well, we had a lot of choice with the Medicaid expansion in Obamacare as well, I should point out.
Well, and for some states that's good, for some states that's been bad. For Don, thank you very much, and I appreciate it.
Thanks for having us, Cheryl.
Bye, guys. Thank you.